You think there's a difference today in neurological leaders or surgical leaders or medical management leadership than in past generations, say just 25 years ago?
I do. When I look back at how my mentors were trained and how I practice now within the world of sports neurology, which is a relatively new subspecialty in the big picture. I practice under the three tenets of Dr. James Andrews, who's the big, world-renowned orthopedic surgeon in Birmingham. And that's number one, humility. Number two, availability. Pick up the phone when somebody calls you, because when they're trying to reach you, that's when they need you. And that's from a patient standpoint. And then number three, quality. If you can't provide quality care, you're not going to have those phone calls to worry about. But those are the three key tenets that he's structured his very successful practice, obviously, and I've tried to follow that same pattern.
How do you deal with a patient that doesn't take your advice? That's got to really be potentially irritating, or maybe just flat out is, or you respect their decision?
No, it's tough, especially if I'm convinced that what they're not doing would help them. That's frustrating for me. But the flip side of that is, we all have egos, obviously, but my ego is not big enough to say that I've reached my limit in what I know what to do in your particular case, and I think that you should go see Dr. X in Chicago, or my colleague Dr. Y in Ann Arbor, Michigan, to get a second opinion. I think that we should always have that degree of humility to admit where I don't know what to do for you next. Maybe we need a different set of eyes on your case.
This might be a little sensitive, but I think the way I couch it, it'll come out okay. Have you ever had an incident or situation where you have a parent that's telling a minor some bad advice, going against your medical advice, and you're seeing a dynamic? I mean, just the law of numbers and the amount of patients and cases you've had, I would suspect you've had a couple of these. How do you deal with that, where you've got the parent-child dynamic going on?
No, I see that a lot, and I would say probably, if not weekly, certainly monthly. Especially in the world of competitive sports here in the Louisville area, which it's very competitive.
It is.
We have young student athletes that are participating in their sport year-round, which the science has shown that's not the smartest thing to do, just from a mental and physical health standpoint. But you have an uber competitive parent combined with an uber competitive student or patient, and sometimes those are influences and interests that don't always gel. And they certainly don't want to hear, you need to sit back and take a little bit of time away from your sport to get you back to a good place.